A warm welcome to everyone. In this video, we begin our study of the joints of the upper limb. Today, we will take a general overview of the joints of the upper limb and then look at the first joint, the sternoclavicular joint, in detail. Before examining each joint more closely, it's helpful to start with a general overview to understand the principles we follow when we're describing a joint.
A joint almost always has its own name. When describing it, we must always specify which bones are involved, meaning which articular surfaces form the joint. Often, the joint's name is derived from these bones, but not always. There are some exceptions, such as the elbow joint, the articulatio cubiti, or the shoulder joint, the articulatio humeri, whose names don't come directly from the bones that form them. Describing a joint also includes stating its type, since the type of the joint determines what kind of movements are possible. Every true joint has certain obligatory components. Without them, it cannot be considered a true joint. These are the articulating bones, the joint capsule, and the ligaments. In addition, there are some optional structures that may or may not be present, such as an articular disc or a meniscus, which help to adjust the articular surfaces if they don't fit perfectly together. These structures therefore compensate for differences between the joint surfaces and improve their congruence. Let's now look at which joints we will discuss in the upper limb. The most proximal joint of the free upper limb is the sternoclavicular joint, also known as articulatio sternoclavicularis. It lies medially in the shoulder girdle and connects the sternum with the clavicle. The other joint of the shoulder girdle is found laterally, the acromioclavicular joint, or in Latin, articulatio acromioclavicularis, which connects the acromion of the scapula with the lateral end of the clavicle. Among the joints of the free upper limb, the shoulder joint is the most proximal. It connects the glenoid cavity of the scapula with the head of the humerus. Although these are the articulating bones, the official name of the joint is articulatio humeri, not scapulohumeral joint, although in the literature the term glenohumeral joint is also used. Further down lies the elbow joint, the articulatio cubiti, which is formed between the distal end of the humerus and the proximal end of the radius and the ulna. The joints of the hand are even more complex and best discussed separately. The most proximal wrist joint is the radiocarpal joint, the articulatio radiocarpalis, located between the distal end of the radius and the proximal row of the carpal bones. Between the two carpal rows lies the intercarpal joint, the articulatio intercarpalis, which allows only limited movements. Between the distal row of the carpal bones and the basis of the metacarpal bones are the carpometacarpal joints, and between the heads of the metacarpal bones and the basis of the phalanges are the metacarpophalangeal joints, also in Latin, the articulatio metacarpophalangealis. Between the phalanges themselves are the interphalangeal joints, which can be divided into proximal and distal. An exception is the thumb, the pollex, which lacks a middle phalanx and therefore has only one interphalangeal joint. Now, let's move on to the detailed description of the individual joints. We begin with the sternoclavicular joint, also known as articulatio sternoclavicularis. This joint lies medially in the shoulder girdle and connects the manubrium of the sternum with the clavicle. On the sternum, the clavicular notch, also known as incisura clavicularis sterni, takes part in the articulation, and on the clavicle, the sternal articular surface, the facies articularis sternalis, forms the opposing surface. Since these articular surfaces are not perfectly congruent, evolution has provided an articular disc, the discus articularis, which divides the joint cavity into two parts, a discosternal and a discoclavicular compartment. In some joints, such a disc doesn't completely divide the cavity. In that case, we speak of a meniscus, as in the knee joint, also known as in the articulatio genus. The articular cartilage of the sternoclavicular joint is fibrocartilage, not hyaline cartilage. Fibrocartilage is more resistant to tensile and shearing forces, which are common in this joint. Several ligaments reinforce the joint. The two clavicles are connected by the interclavicular ligament above the jugular notch. We call it in Latin ligamentum interclaviculare. Between the sternum and the clavicle, both anteriorly and posteriorly run the anterior and the posterior sternoclavicular ligaments, also known as ligamentum sternoclaviculare anterius and ligamentum sternoclaviculare posterius. A particularly important ligament is the costoclavicular ligament, which runs between the underside of the medial end of the clavicle and the cartilage of the first rib. This ligament prevents excessive elevation of the clavicle and serves mainly a stabilizing and limiting function. The sternoclavicular joint is a restricted ball and socket joint, also known as in Latin articulatio spheroidea imperfecta. It allows movements around 3 axes, though the range is limited by the ligaments. The movements include elevation and depression, protraction and retraction, as well as rotation around the long axis of the clavicle. When these movements are performed in sequence, the lateral end of the clavicle describes a circular path called circumduction. Thus, the sternoclavicular joint allows multidirectional but limited motion and plays a key role in the movements of the shoulder girdle, as the movements of the clavicle are transmitted through this joint from the tongue to the upper limb. Thank you for watching.